RDaSH needs to win the Nursing Times Award and grounded research particularly. Research is a key element of all nurses' practice. And what grounded research has enabled us to do is to embed that into everyday work and everyday thinking of nurses across the Trust. Because nursing research is presented at every nursing network meeting that's held, and the nurses that attend the nursing network are across all specialities the Trust delivers services in. So that's adult mental health, physical health, older adult mental health, children's services, CAMS, learning disability and forensic services. And what the nurses at the forum said was that research was really important to them, and they were looking for a vehicle to be able to get that voice heard and the support that they need to undertake research, and grounded research met that need.
A big part of my role is to support the learners in practice, and that includes pre-registration nursing students. We work with a number of universities because of our geographical spread, but also because of the different fields of nursing that we actually accommodate all fields of nursing, because we are mental health, learning disability trust with community and adult services and children's services within children's mental health services. So for the students, that gives them a real opportunity to have an absolutely grounded, I think, learning experience. Working with the research office within RDaSH to look at the opportunities for student nurses to spend some time in the research office, where they can really see, I think, probably for the first time, how research and evidence-based practice really does underpin the work we do in our organisation.
The approach has given us is more critical nurses. So it's not nurses that follow policies, procedures, just because they're there. It's nurses who think, is this applicable to these people we see now? What we know in our services is that we are increasingly coming into contact with people who have high levels of complex need. This is because there's lots of different things happening in society, in terms of health, and our nurses are faced with people who are of a different level of complexity than they were before. Taking a research-based approach allows them to be more critical about whether this NICE guidelines particularly applies to this patient group, to think as a multi-professional team about how they can apply different approaches to people based on current evidence, but different evidence, because there isn't a specific guideline for this person considering their complexity.
Well, I was part of the RDaSH capacity building project when I was seconded from Sheffield Hallam University to work with RDaSH when they were really setting out on a brand new journey. Hadn't really thought about that a lot before, and I spent a couple of years working in partnership, and that culminated in a particular project I'd like to talk to you about, which is the Burdett for Nursing project, which was externally funded and is exploring early discharge from acute and crisis care mental health services. And the whole purpose of that project was to bring together all the different parts of capacity building, so to look at bringing in some money, allowing people to work on projects, thinking about their project management skills, looking at costing and funding and how things get paid for in research, but also keeping things to time and task and having outputs that are timely, because they're the skills that sometimes nurses do have because they use them in other ways. They use them to manage clinical services, and it's enabling them to see that those skills are transferable and they can use them in different ways. I think it would be a fabulous next step for RDaSH to win something as prestigious as a Nursing Times Award, because RDaSH have been working consistently hard from the bottom up on trying to get nurses engaged in research, and rather than trying to go for the showy, flashy, big things straight away, I think RDaSH have taken the absolutely correct strategic approach, which is to go in with clinical nurses, find out what's important to them, and actually work alongside and get academics and nurses work in practice and in leadership and management to talk to each other, and for me that's likely to bear fruit, and therefore as a solid piece of work, and therefore as prize winning. It should absolutely win a Nursing Times Award.